We're going to go over 5 rules that are you can't break them
Yeah.
for arthritis pain. So we're going to start off with number 1. If you have arthritis in a joint, we'll use the knee as an example.
Sure.
You want to decrease the weight on that area, especially if it's flared up.
Right.
So, like if you're going to use a cane, that'll help take some of the weight off the area.
Right.
Number 2, keep it moving, but in a non-weight bearing manner. So a lot of people say, "Oh, it hurts, so I should let it rest."
Right.
But that's not the way arthritis works. Arthritis actually creates, if you get some movement, you get synovial fluid, which is like the grease for the joint.
Yeah, it's the lubricant in there, and it will help settle things down.
All right. Number 3, you want to make sure you keep it stretched out because if you're lacking motion, that will make the joint hurt worse. So if you're lacking, you can't fully extend your knee. Let's say you only go to here. That's going to work a smaller area, and it's going to wear out the knee faster. So you want to make sure you actually take the time to work on stretching the knee into full extension. And this is something you might want to do like every hour.
Sure. Yep.
Just a little pressure on, pressure off. Number 4, also very important to keep the joint as strong as possible. So one way, let's use the knee again, is you can do isometric. So with the knee, very simple. You can fold up a pillow like this. I'll get you, Brad.
There you go.
There we go. And I'm going to push the knee down to the bed, and I'm tightening the quadricep and making it work. So hold for a count of 10, and then relax.
Yep. And oftentimes, you don't have to go to the gym. You don't have to buy fancy equipment for this kind of strengthening. You can do things like this.
3 sets of 10,
Yep.
3 times a week, and you're good. Number 5, this may be a little unusual to people. You want to make sure you eat right. There's anti-inflammatory foods. We had a lady on who had trouble with rheumatoid arthritis, right?
Rheumatoid?
Rheumatoid,
Yep.
right. And she helped combat it just by changing her diet.
Oh, you're talking about Jody?
Yeah.
Yeah, she was fighting. She did not tolerate the meds. The meds were not going well with her. She's getting kind of mad at her doctor, actually.
Right, she was.
And she did some research on diet, and she found she could get off of her meds and control things by her diet.